Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docuseries.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello, everyone, and welcome back to our FIRRIMup Doctors webinar. I'm so glad for all of you that are joining us today. Today, we're actually going to be talking about some hair restoration and platelet-rich plasma, as well as some hair loss issues. So I will go ahead and introduce your FIRRIMup doctors, Dr. Angela Yakey and Dr. Kathleen O'Neill Smith.
Hi, everybody.
Hi, everyone.
Hi, Dr. Kathleen in Boston. How are you?
Good. How are you doing down there? I hope it's warm.
It's great in Florida. We're really blessed to live here. You know, with the COVID spike, I know a lot of y'all are back to quarantining and sheltering in. I can't imagine with the sun going down at 4:30 how that would feel. So I feel
it's pretty bad up here. Pretty bad. And I think people's moods are, I think there's a charge. I think people feel a little activated, charged, and have a lot of uncertainty. And obviously the holidays coming up in a week. And I know that people are really anxious, running around, very difficult to get testing here. We do it, but we don't see people who are sick actively. They have to go to the hospital setting, but it's still very difficult.
Yeah, well, we have opportunity, and I know you do too, for rapid COVID swab testing, antigen testing through those 15 minutes, right?
Yeah, it's really good stuff, but it's hard for people to get.
Yeah. Well, I'm glad you could come, and I just wanted to go over the schedule. So basically today we're going to talk about a variation on the theme. It's actually skin month, but we went deeper into the fascia or soft tissue. But you know, when you think about things that keep the fascia healthy, it's the same things that keep the hair healthy as well. And so that's what we're going to be talking about today is hair restoration and platelet-rich plasma. And then we're going to take a break for Thanksgiving. Happy Thanksgiving, everybody. Thank you for joining us week after week. But that now with the COVID surge, over 250 million American, 250,000 American lives lost, we thought it would be important to go back to COVID in December. So the first week in December, we're talking about COVID testing for safer gatherings and celebrations. The second week, we're going to be talking about the vaccine coming online, and then open it up for Q&A because our patients and clients have a lot of questions about COVID. Sound good, everyone?
Lots of questions. I'm amazed at how much confusion there still is. And I think it's really important to understand it and to revisit it. I still think that the book that we wrote is still very accurate and feel very proud of that. But I think we need to help people understand it because a lot of docs don't even understand it. And I think there's a big business around COVID as well, not in the right spaces because there are people whose businesses have had to shut down. So it is important to revisit this and help people understand, you know, really what is valuable and what will give them the information that they need depending upon the situation. So it's really, really important. I'm looking forward to it. And I'm really happy to talk about flowing hair for the holidays.
Absolutely. So yeah, getting back to our guidebook, I saw a patient today who's 67 and a healthcare worker, radiology tech, who is on day 13 of her COVID illness and has done extremely well. But she actually, because she was sidelined for COVID, actually had the time to read our guidebook and thought it was excellent and is recommending it to everybody. So it is still pertinent, still up to date. And we've had over 20 YouTubes on COVID, nutritional interventions, et cetera. So we're going back in December because of the surge.
Yeah, repetition's good. I think we can always start superficially and keep digging deeper and helping people understand. It's not like we understand any of this in a day, as you can see by how confusing the information is that's out there on the news and in the media and on the web and you name it. So I think it's our duty to help people understand with clarity where to get, what test to get, where to get it, and how to interpret it.
Exactly. So, okay, great. Everybody, now we're going to move to today's topic. There are 3 hair loss case studies. Next slide. The first is actually a picture of a patient I saw in telehealth yesterday who's a 72-year-old woman who experienced pretty severe COVID, didn't need to be hospitalized, but her oxygen went down to the low 90s in September. And she just sent me a picture of what her hair looks like after she washes it every day. And so basically, this is a condition called telogen effluvium. You don't need to know that term, but what it is essentially normal hair is mostly in kind of the growth phase 90% of the time. When your body goes into extreme stress, such as experiencing COVID in September, like this woman did, it goes into, what happens is that the cells go into kind of rest phase and doesn't, you don't replicate you don't grow the hair as normally. So it's a non-scarring condition to hair where you lose your hair. And it's really scary, especially for women when their hair starts thinning.
My gosh, how many people have come into your office over the years? It's been decades, right, that we've been doing medicine.
Yes.
And people come in all the time. And a very common concern is, I'm losing hair. Why? And there are many, many reasons why people lose hair, but hair is less necessary than your gut function, right? Your pancreas function, your liver function, and it's intended to shed. So there's a healthy shedding phase to hair. So when hair enters that shedding phase earlier than it normally would, we definitely lose it. And stress is one of the more common reasons. And with respect to stress, infections are a very, very common source of stress, whether they're infections that we know we have, like COVID, or whether they're asymptomatic and we don't know we have them. Mono can produce it, but usually the hair will grow back. Usually there's not a lot of treatment. Unfortunately, it takes a long time, for it to occur, so people don't necessarily relate it to the event. It can take a month or 2 or 3 months later. And it also takes another 6 months or more for it to be restored. So I think it's a really difficult situation for people, but there are many reasons for hair loss, COVID and other infections being primary ones.
Yeah, those are great points. I think it's important to see us or see your doctor to make sure that your scalp doesn't have things that would alarm that it's something else other than stress-related telogen effluvium, such as rashes. If there's rashes, then we worry more about other conditions like psoriasis or autoimmune disease or other type of condition that would be causing the hair loss. So I like what you said, Dr. Kathleen, that hair is not critical. So when the body's in survival mode, it's not replicating the hair cells. It's not in the growth phase. Normally the growth phase, again, is about 90% of the hair growth cycle. Then you have a rest phase, which is 5%. Then you have a shedding phase, which is 5%. So after extreme stress, the growth phase goes down to about 50%. Therefore, you're shedding a lot more. At least you're thinking you're shedding a lot more.
Yeah, it's really important. I mean, I think everyone, if they have hair loss, should have it evaluated for sure. For whether all they get is reassurance or they have other treatment, but you should definitely pay attention, because if it's not a telogen effluvium and if it's something else, you're going to miss an opportunity if you intervene too late, like 6 months later, if you don't really pay attention to it. And the other thing I need to say is, in my experience, even though in conventional medicine, when I practiced that, people thought it was the thyroid and I thought it was the thyroid, but now that I'm unconventional and regenerative, I hardly ever find it being the thyroid that causes hair loss.
Yeah, I agree. I think, the answer on the medicine boards was thyroid or have a nutrient deficiency, but a lot of times we're getting the impossible cases like immune problems or immune confusion or regenerative, that would respond to regenerative care.
And if it's a nutrient problem, which it can be, you got a gut problem. If you have a nutrient absorption problem and assimilation to help hair grow, it's not just biotin. There's an absorption issue because there's abundant nutrients in your food supply, I hope, as long as you're eating well and eating some live foods. But if it's a nutrient problem, you have to look at the gut and find out, how do you fix the gut so that you can get nutrients? And ultimately, how do you fix the immune system? It all comes back, regardless of COVID, to the immune system. Really does.
There you go. Okay, let's move on to case 2. And we have a little video for you. This is a 52-year-old lady from California.
So what are some of your other symptoms?
I had symptoms right away with night sweats, sleeping, not being able to sleep, crankiness. I started getting arthritis in my hands, and that, when you lose the function of your hands, they're vital. And to be in pain with your hands, it's awful, along with the hair loss. And then I started seeing little vitiligo, white patches on my legs and stuff. So I think I have an autoimmune problem, and that's why I'm here today.
So as we were saying, very often it's much more than just hair loss. This is actually a 53-year-old woman who was well until she had a hysterectomy about 10 years prior. And she gained 30 pounds and she started losing hair, and her conventional obstetrician gynecologist said it was normal, don't worry about it. Then about 2 years ago, she ended up seeking a second opinion. A dermatologist biopsied her scalp, and it showed the immune system army, the lymphocytes were attacking the hair follicles. So in other words, she had autoimmune disease. So she had presented to me with the arthritis, insomnia, and vitiligo, which is an immune problem as well. So as we had said, it's not just usually just thyroid or need for biotin. It's often a complex condition.
Yes, of course. And our goal is to teach you about how these things relate. What things relate to what, how many, where the arrows have to go, and how can you get to the bottom, the root causes, and begin to treat foundationally and then build on that. So you always have to look at everything. You have to look at the nutrients in a situation like this. You have to look at the hormones. She's had a hysterectomy at a young age. You have to look at her stress level and what's going on in her life. You have to look at how she sleeps. You have to look at infections. You have to look at all of it. And it's really an appropriate time to get a baseline. Actually, 43, when she had the hysterectomy, prior to the hysterectomy, was the appropriate time to get the baseline. Unfortunately, that's not what all doctors do. But that's what we would have done. That's what I certainly would have done. And, it is what it is. 9 years later, 10 years later, whatever it is, you can get a new baseline. But you can't make any assumptions. You have to get a baseline, and you have to understand the problem to really fix it.
Yeah, so she required hormone balancing.
Let's look at the next slide.
Yeah. And so I actually diagnosed her with systemic lupus erythematosus, which is an autoimmune condition by biomarkers or blood work, as well as her presentation, her symptoms. And so, Dr. Kathleen, you want to walk us through this great slide from New England Journal of Medicine?
Sure. I love this slide, because regardless of whether this is lupus, thyroid disease, nutritional imbalance, all of the factors, 5 factors on the top of this slide, are involved. One factor will never be the sole cause of hair loss or of organ damage. There'll be genetic predisposition, but there are things called epigenetics, and that means that food will influence your genes, your environment will influence your genes, how healthy your air is will influence your genes. And so it's really, really important to understand that there's a genetic predisposition, and something, second one over, environmental, is speaking to the genes and having them respond in an appropriate way with an inflammatory response, immunoregulatory or immunodysregulatory. You're going to get antibodies, you're going to get T cell cytokines, immune complexes. All of that immune system in the middle is going to respond in a way that's appropriate for the environmental challenge on specific genetic predisposition. The hormones can and will be disrupted, and epigenetic we talked about. Those are the external factors that influence how your genes function. And ultimately, all 5 of these factors have a role in disease. And it's really interesting because, unfortunately, in lupus or in type 1 diabetes, another autoimmune disease, many organs can be affected. In each autoimmune disease, it can be 1 of these organs, 4 of these organs, or it could be hair or something that's not even here. But the reality is that when you are not feeling well, we have to understand how to protect and prevent all of these organs from being involved. And in lupus, we know that immune confusion, so confusion to the immune system, results in autoimmunity, so immunity to self, meaning your antibodies will attack self. You'll get T cells, white blood cells that will attack your organs, and inflammatory cytokines that will contribute to all of this. So it's really important to see the complexity of this. And it's the same thing with COVID, right, Dr. Akey? You know, you get an infection from the environment. It can affect your hormones. It can affect your immune system. It can affect your genetics. The people with a certain genetic profile will be the ones to get even sicker if they don't have any other problems. So it's really important to understand that this is a complex and interrelated process that happens, and oftentimes hair loss will happen when any of the 5 factors at the top gets dysregulated or interrupted.
Yeah, that was a great explanation because it's really important to generalize this to any autoimmune or any immune condition such as COVID. And I'd refer everyone to Kick COVID-19 to the Curb. Part 2 of the 4 parts in our guidebook actually goes into detail in an analogy of a chess set and the immune system. It will really help you to understand what we were talking about with these immune regulatory cells. We call the T cells the queen because they're really, really important in the immune system. And what's happening with immune confusion in lupus, for example, is friendly fire. So with her, I did test, and even though her anti-nuclear antibody had been previously negative, it was positive when I checked it. And in addition, she had low levels of T cells. So that plus a couple of other criteria, and I diagnosed her with systemic lupus erythematosus. So isn't that scary? So lupus has anti-nuclear antibodies. It's your own antibodies against your own DNA. So it's really, really important to go deeper, fix the gut, work on her immune system. Next slide.
Wait. I want to just say something. That was brilliant. And I think that just for the sake of repetition, because I like to be a teacher and make sure you understand it.
You're a great teacher.
You did a great job on lupus and autoimmunity. I want to come back to those antibodies on the middle right and the T cells on the lower right, and basically demonstrate that those 2 things are what we want to look at when we're looking at COVID, right? So when we talk about COVID and the testing next week, yes, there are graphs in our book. I think they're great. And this is another way of looking at it. We're talking about T cells and antibodies. We're also talking on the bottom left about the cytokines and the cytokine storm. So you get inflammation, you get all kinds of things that are going on, and these immune complexes as well that circulate. So it's a complex process, which is why, you know, even as a physician of decades, it's not like we understood this in a minute. It's not like we understand all of it, but we can certainly, because we understand the biochemistry and the pathophysiology and normal physiology, we can understand, you know, what kinds of things can go wrong in the basis of the 5 factors above, the middle products that are our body's appropriate response, and then how those middle 4 factors can cause damage to the organs.
That's a great point. You're setting us up for December. But remember, with the immune system, you want not too much, not too little. And cytokine storm is uncontrolled too much inflammation, too much, and that's why the lungs get damaged, for example. So great. I'm glad you brought that up.
I think the other thing that Dr. Akey is going to describe, when you remember those 5 factors, she's not going to get into the genetics because that's a little bit more complicated. She's going to talk about environment. She's going to talk about epigenetic. She's going to talk about hormones. And then she's going to talk about the immunoregulatory therapies that were used to treat this patient. Next slide.
Okay, so I immediately, when I saw her in July of 2018, knew she was only on estrogen without any progesterone. So in conventional medicine, they say if you don't have a uterus, you don't need progesterone. If you listen to last month's talks on hormonal balancing, you heard from me, Dr. Kathleen, as well as Dr. Annika Becca, that even without a uterus, you need progesterone. It's neurosupportive, and it's God's Valium to women. It calms us down. And it balances the estrogen, because estrogen dominance, or having too much estrogen and not enough progesterone, leads to weight gain, irritability, brain fog, and breast tenderness, growing breasts, which we see all the time. So I balanced her hormones right away. In addition, I asked her to do some meditation, manage her stress, got rid of gluten and dairy as an initial step. I had met her at a conference and I didn't have data, but I said, gluten's inflammatory in general. Dairy, animal dairy is inflammatory. Stop the gluten and dairy, which she did. And I asked her to start exercising. So I met her in South Florida and with you, Dr. Kathleen. And we did really fun regenerative therapy to her scalp. So there she is. On the day we met her in South Florida, August of 2018, she had that condition called frontal fibrosing alopecia, or loss of hair due to lupus. You can see it's pretty severe. And this lady used to be a model in her teens and 20s. So it's really quite devastating to lose her hair like this. And on that day, we drew some labs, diagnosed her with lupus subsequently, but also did these regenerative medicinal signaling therapies and platelet-rich plasma. Do you have any comments on that, Dr. Kathleen?
Yeah, I think it's really brilliant. I mean, one of the things in terms of her fascia, if we only have estrogen, because Dr. Akey and I and our fantastic interns at Dr. Akey's office, basically helped us write chapters on that it's really necessary to have these hormones to create healthy fascia. And just underneath the skin is the fascia where the hair will grow. And I think if we think about her hair loss, we think about her weight gain. Her fascia wasn't healthy. She gained weight. She gained more adipose tissue. Her body composition changed, which is not uncommon when the body is undergoing stress. It is the body's response to stress. And I think the pain and the aching, remember, I mean, maybe we haven't talked to you guys about it, but we talk so much about it, Dr. Akey and I, that pain is all about the sensory organ, which is the fascia. So this is really, again, a fascia webinar, which they'll all have a component of that. We'll bring it back to that. But the pain in her hands was not surprising. She had those inflammatory cytokines throughout her body, giving her this pain and aching. So I think that in order to rebalance, it's really, really optimal to do all of these things: the stress, the food, the nutrition, the movement, the sleep, the hormones, etc. And you can see beautifully, maybe, from the left, middle, and right in the diagrams, that she's got hair growth coming in. And she continued to get hair growth even later. I mean, that was in February 2019, but we both have seen this person and know this patient.
Yeah, so thank you for pointing that out. Clearly, there's a fascial component, because at 6 weeks later, the pictures 3 and 4 shows that there is some hair growth at 6 weeks, and she also had a 35-pound weight loss since July, since I met her at the meeting. So for about 10 weeks, she lost 35 pounds. So her hormonal balancing was better. Her hands were aching prior, such that she couldn't open jars. Well, she could open jars. She had improved energy and sleep. And as with a lot of FIRRIMup interventions, functional, integrative, regenerative, restorative, internal medicine approaches, it's never just one thing, right, Dr. Kathleen?
Never. I wish it were. We wouldn't have our jobs if it were that easy.
But the picture's worth 1,000 words. So there she is at 6 weeks in October of 2018 in picture 3 and 4. And then we saw her subsequently 6 months later in February of 2019, and she continued to have hair growth. Now, as with all interventions, unless you continue to be compliant, do your movement, avoid the things like gluten and dairy, which she was doing, take your hormones to be balanced, you will slide again. So I actually saw her in the summer, 6 months in the summer of 2019, and she had a little slide back. So she needed some encouragement to keep doing the good things to keep her hair and her body healthy. So for her, it wasn't so much about the hair, although it really was alarming. It was her function, her hands and her aches and pains, poor sleep, etc. So she just needed some gentle guidance to get her back on track.
Next slide. Well, everybody has a genetic predisposition. So remember that genetic factor in that one photo that we showed you, the illustration, because genes, we can't beat our genes. We can make them function better, but they are what they are. This little boy that came to my practice, he came in May. Well, he actually came in December of 2014. He had been on vacation, school vacation. He's 11 years old here. So he was on school vacation with his parents traveling, and they called me panicked from vacation because he had lost all of his hair. So you're seeing him now in June, photos in June of 2015, but December of 2014, he had literally lost all of his hair. So they thought it was Lyme, and they were convinced it was Lyme. He was nowhere near any Lyme issues, but that's okay. And he had no real reason to think it was Lyme, which is why clinical prowess is really important. But they believed it was Lyme because people had seen, that they knew had seen Lyme cause this kind of a problem. At any rate, they came back. They wanted to go to Children's Hospital in Boston. I said, that sounds great. Go do whatever you can do there. And he did. And they put him on steroids and they put him on minoxidil, and they basically didn't get any hair growth. And of course, we know that one of the side effects of Rogaine minoxidil is also potentially worse hair loss. So they never worked up to see why he had hair loss in the beginning, but they tried to treat him just off the cuff with minoxidil, and he lost more hair. So they came back to see me in May. They didn't come in the interim because they were working on all these things and it takes time. And he was also in school. They live in another state. I live in Massachusetts. So he came in May and I saw him, and I had seen his family before. So I was really, upset because he was very upset. And so we decided to do some treatments. So again, like Dr. Akey, for this boy back then, I did a series of medicinal signaling treatments, cleaned his gut and cleaned his diet. And he was receptive to that because he did not want to be bald. He wore a hat all the time. And he was only 11. He was wetting the bed again, which he hadn't done in years. So it was really traumatic for him. And then we also did PRP. So I did PRP on him multiple times. First in May, he came back for a visit. I wasn't, back in mid 2015, I wasn't taking photographs of everything because I just wasn't. But then when he came back and I saw the hair growth, I took pictures. But you can see up on the upper left how shoddy he still has a lot of alopecia, spots there, pretty significant. And so then I basically had him come back 2 weeks later, and we took photos of his hair, and it continued to grow. And I did another treatment. He was heading to Nantucket, the islands, for the summer. So I had his mom 9 weeks from the beginning of our treatment. He had done 3 treatments. I had the mom send me photos from their home, and look it down on the bottom left at 9 weeks, July 26th, how wonderful the hair growth is. I was absolutely shocked. We treated him one more time with the medicinal signaling therapies and the PRP. And in 17 weeks from initiation, he had an entire growth of hair. I was pretty blown away. He was exceptionally good with his diet, exceptionally good with, sleeping and not having sleepovers and doing everything necessary in terms of the lifestyle behaviors because he wanted his hair back. This child was motivated, very impressed. Dr. Kathleen, what can I do? I'll do anything you say. And he really did. 11 months later, by April of the next year, he had a full growth of hair. And like the former patient, we have to still continue. It's now 5 years later, right? We're more than 5 years later. And I would say intermittently, not frequently, but intermittently, certainly annually, we measure his nutritional status, his hormonal status, try to understand. We do very rare therapies with PRP and some MSTs, but generally speaking, we were following him also because his mom had Hashimoto's thyroid disease. He did have some abnormal thyroid numbers, but they didn't consistently stay abnormal. And one of the things that Dr. Akey and I both know is that the symptoms, the hair loss of lupus or the hair loss of thyroiditis, can show up before the numbers are off in the lab work. So it's just really important to understand that, which is another reason for continuing to follow any patient who has hair loss, getting baseline numbers, continuing to follow to see when those numbers go awry, and to understand what is going on in the immune system with antibodies, with T cells, with cytokines, with immune complexes, with nutrition, with sleep, with stress, with infections. For example, at one point, I think in about 2018-19, this little boy who is now grown ended up with mono. And he got really sick with mono and had a big bout of hair loss, which happened probably slightly before the mono, but big time post the mono. So mononucleosis. So it's really important to understand that lots of infections can impact hair. Anything autoimmune can impact hair, and inflammatory things and hormones can impact it. But it's just certainly important to be followed by a physician to understand that you need a baseline. Over time, you have to follow the patterns of changes in those baseline biomarkers and understand how you're going to optimize your well-being, your health. And that's what this little boy and everyone in his family does. It's fun to be able to see this.
Really great work, Dr. Kathleen. So we actually presented these two cases and one other on lupus at the CORA conference, the Controversies on Rheumatology and Autoimmunity, in February of 2019 in Florence, Italy, an international congress to really try to understand immune conditions. And it was Dr. Yehuda Schoenfeld of Israel who put that conference together. We were so blessed that he gave us an endorsement on the forward of Kick COVID-19 to the Curb. But for this crew to remember that he actually said that 1 in 5 people actually have markers for immune confusion or autoimmune disease. And as Dr. Kathleen said, that any infection could trigger immune confusion. At least in the COVID literature at this point, we've seen case reports of Hashimoto's thyroiditis, Lou Gehrig's or ALS, myasthenia gravis affecting the eyes as immune insults following the COVID-19. And you just learned how it could affect telogen effluvium, which is not autoimmune at this point. As far as it's a stress-related condition, but it could cause hair loss as well. Mm-hmm. So really great points.
I wanted to say one other thing. The reason, PRP is what we consider a fascial treatment. And there are multiple factors, growth factors and healing factors, that we can concentrate in platelet-rich plasma, that we can deliver to the tissue and allow and give it some of the ingredients, nudge it to heal. With the medicinal signaling therapies, we consider medicinal signaling therapies to be nutritional, hormonal, antiviral. Actually, kind of sort of all therapies are medicinal signaling therapies. I certainly love, and Dr. Akey as well, peptides. So peptide therapy is also another very important medicinal signaling therapy. There's cellular mesenchymal stem cells, and you've heard from Dr. Ian White on this webinar. There's acellular mesenchymal, they're not cells, but mesenchymal fluid, like amniotic fluid. There are all kinds of medicinal signaling treatments and therapies that work to upregulate genetic expression and reduce inflammation and try to restore balance in the tissue. So it's never one thing, but it's really, what do you think you're going to get a safe, effective, and sustainable result with for the patient that improves their health span in that moment and in the future?
And I think it's really important to realize that this approach that we've taught you all in regards to hair loss can be applied across the board in not only reversing and treating chronic disease, but preventing it. And we're so excited to announce again that we are offering 12 spots in the Pursuing Optimal Wellness Masterclass. It's a 12-week program where you're working with us virtually starting the end of January for 12 weeks. And you'll feel very much connected to us in the way we think should you decide to sign up for this particular masterclass. So Q&A. Okay, I'll send one to Dr. Kathleen. I was on PRP, then stopped it for 8 months because of the pandemic. I had terrible hair loss, and now I'm back to PRP. Hair loss is better. My question is, does stopping PRP trigger hair loss?
Ooh, I'm going to be disappointed if I haven't answered that question, but I'll tell you again, because I love repetition. It's never one thing. But your first concern is probably, if I stop PRP, do I get worse than where I started? And typically, no. You go back to where you would be. So PRP does not produce worse hair loss, for sure, guaranteed. Is PRP the whole solution? No. The question I would ask is, do you know your baseline biomarkers? Do you have a sense of potential etiologies thinking about those 5 factors? And are you attempting to address all of those 5 factors? Epigenetics. You can address your genetics because we can change our nutrient status, we can change our medicinal signaling therapy status, and we can make those genetics function better. So that's epigenetics. Is there an immunomodulatory problem? Is there a hormonal problem? Is there an environmental problem? Or is there a lifestyle problem? All of those have to be looked at because there's likely some component, as small as it may be, that could be the missing link to keeping whatever you did with PRP growing. Because I can tell you, for this young man who, now it's 5.5 years out, or almost 6 years, actually next month it will be 6 years out, he essentially has pretty good hair right now. I would say that he doesn't have any, alopecia areata, little circular bald spots. He has a little bit of wispy spots that are missing. That's pretty phenomenal. We did do a lot of gut health, as you mentioned earlier, Dr. Akey. And it is important to be thinking about that.
Okay, great. So just to summarize, we went through a lot of concepts today, Dr. Kathleen. Thank you so much. To summarize for our listeners, remember that if you have hair loss, you want to think of those 5 categories and work in conjunction with your doctor to make sure it's not some other cause for hair loss, like a nutritional problem or a thyroid problem or an autoimmune problem. But remember the big categories: genetics, environment, immunoregulatory, hormonal, and epigenetic. The second point is that do work with the doctor and let us examine your scalp, as well as order nutritional studies as well as biomarkers. For example, with the case of lupus, I was the one that ended up diagnosing her with lupus, but she had seen multiple doctors prior. So just make sure you reach out to your doctor and get some testing. And thirdly, remember that in our opinion, it's really about caring for your immune system that will determine your long-term health. And we would invite you again to relook at Kick COVID-19 to the Curb. And I think that's about all I have to say about this particular webinar. Dr. Kathleen, anything else?
No, fantastic. Good summary. And I hope that was really helpful.
Happy Thanksgiving, everybody. We're really grateful that you have been following with us since March. Thank you so much for joining us. And if you're interested in joining our POW or Pursuing Optimal Wellness Masterclass, just let Emily know through the email, FIRRIMupDoctors@gmail.com. So for now, everybody, be safe, be well, and God bless you all. Thank you all for
Many
coming.
blessings. Happy
Hopefully
Thanksgiving.
Thank you. Bye-bye.
Bye.
That was wonderful. And now I have some great supplement deals for you guys, as well as the books that we have available. So the first one is going to be the same as the last 2 weeks. It's going to be the vitamin C and the collagen. Again, these are just great to always have in basically in your everyday regimen. The vitamin C is going to help with absorption. And if you want the vitamin C code, it is going to be FIRRIMup VITC, VITC. And the collagen has many, many benefits for both hair, skin, nails, joints, ligaments, tendons, just really everything that you can think of all packed into one. And the 10% off code for that is going to be FIRRIMup Collagen, COLLAGEN. Again, both of these codes are good until the last day of November. So make sure if you are wanting either of these, you go and get them before they are gone. And then for the last supplements we have today, we have the omegas, which again are just absolutely wonderful for heart health, eyes, brain function, immune function, just a great way to get all that in your, your daily supplement. So for everyone who is not a vegan, your code is going to be FIRRIMup Omega, OMEGA, and that's going to be 10% off. And if you are vegan, we have the special algae omega, and your code for your 10% off is going to be FIRRIMup Algae, ALGAE. Again, both of these codes are also good until the last day of November, so make sure you go get them before that code expires. And then as always, we have our November special. If you buy a Kick COVID-19 to the Curb guidebook, whether it's paperback or ebook, you can go ahead and get 20% off of the ultra potent vitamin C and the zinc AG. All you have to do is show proof of purchase, which can be a screenshot, an email, a receipt in person, anything that just can provide that you paid for this, and we can see that. Our paperback guidebook is $29.99 and our ebook is $9.99, available on Amazon Kindle, Google Play, and Barnes & Noble. You can also go to our FIRRIMUpDoctors.com website and you will find links to each of these, both the paperback and all of the ebooks available. And then we have the Fascia Function and Medical Applications textbook. We have, again, a limited amount of paperback copies at the NFIM office for $55. If you're interested in this, please send us an email at nfimgmv@gmail.com, and that will be $55. It's also available on FIRRIMUpDoctors.com and Amazon.com. As I've mentioned before, if you would like to take 20% off, the coupon code is going to be SCI20. Again, SCI20, but that code is not available for use on Amazon.com. So make sure that you are getting that through our website, FIRRIMUpDoctors.com, or by emailing us and picking that up curbside. And then lastly, we have the Fine Tune Your Hormone Symphony, which is Dr. Akey's first book. Again, this is also very good for kind of getting your understanding of your hormones and how everything works all together. And this is going to be available on our FIRRIMup Doctors website as well, FIRRIMUpDoctors.com. Basically, if you go onto our website, you can find a link to pretty much anything and everything we talk about here. But that is all that I have for you today. I hope that you have a wonderful and safe weekend and a very happy Thanksgiving, and we will see you that first week of December.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMUpDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.